Medically, heart attacks are known as STEMIs, or ST-elevated myocardial infarction. An ST elevation is a characteristic sign on an EKG indicating injury to the heart is underway, probably from a closing artery. Our regional STEMI program at Integris Heart Hospital combines new technology with highly choreographed workflow and an ultimate goal of improving the treatment time of someone suffering a heart attack. Ultimately, it will save lives. We have developed an EKG-based rapid response protocol program that will give Oklahoma residents living in rural communities access to the same type of care provided in the metro. This pilot program will be in 17 communities along Highway 81 and Interstate 40. It will impact more than 300,000 people.
The small mobile 12-lead EKG device being used is a brand new product designed by Physio-Control called the ReadyLink. Integris Heart Hospital at Baptist Medical Center will be the first healthcare system in the country to use the device. It is designed to adapt to the medical knowledge and training of the first responder, as well as the physical needs of the patient, enabling fast, smooth transitions from the scene through EMS to treatment at the hospital.
Time is of the essence when suffering a heart attack. As time passes, the amount of the heart that can be saved diminishes. The artery must be reopened in less than 2 to 3 hours, or otherwise we will have serious damage to the heart. It all begins with a 911 call summoning the EMS unit to the scene. An EKG is done within 5 minutes at your home or even in your office. The EKG is immediately transmitted to the one-call command center and distributed to emergency room staff or an on-call cardiologist. A code STEMI is declared and our lead medical personnel are activated, perhaps before you're even leaving the driveway of your home. Patients will be located by GPS systems, and the fastest available transportation will carry them to the hospital equipped to open their arteries. This early activation and time for planning will eliminate many delays in handoffs and services downstream. The time savings make it possible to open arteries in under 2 hours, even when you're located many miles from a treatment center. The success of the program depends on a collaborative effort, not only from our employees, but first responders and other hospitals around the state.
Although this patient lived an hour away from the hospital, it was not a barrier in getting him the necessary treatment in the right amount of time. Through the patient's action and calling 911, the heart attack was able to be rapidly identified using the EKG rapid response process. Because of this, I was immediately contacted and waiting for him at the time of his arrival. The cath lab staff was also prepared, which reduced further delays that could hinder timely treatment. With this program, we were able to have his arteries open well within the 90 to 120 minute recommended time frame.
Developing systems of care serving the Oklahoma population is the future of medicine. This is one such system demonstrating all of the necessary elements necessary for success in managing patients with STEMI or heart attack. The formula for success is the new technology, old-fashioned training, advanced information technology, and innovation. Where you live will no longer determine whether you live.
Heart disease remains the #1 killer of Oklahomans. Therefore, we must be diligent in our efforts to fight this disease. Our partnership with other groups, such as the first responders, has been vital in our efforts to expand this program across Oklahoma. As healthcare providers, innovation and forward thinking is imperative to providing the best care. At Integris Health, our mission is to improve the health of the people in the communities we serve. And we are proud to further that mission through this innovative, life-saving program.